And we have the amazing, brave, beautiful Dr. Alexia Gaffney Adams is in the
In
building.
the
You all
building.
joining us
Give it
all
up,
the
give it
way
up,
from
give
New
it up.
York. Woo!
Yeah. We
Woo!
got an empty studio, so we got to make it sound loud, right?
Oh, okay. I'm joining
Yeah.
myself.
Thank you.
Welcome to Spotlight Over the City, Dr. Alexia. How are you?
I am doing wonderful, but in the midst of wonderfulness, a lot of stress and admittedly some anxiety as well.
Yeah.
Well, it's definitely understandable.
We can
Definitely
imagine.
Understandable.
Before we get into any types of questions, I just want people to know how amazing you really are, because you are a survivor, or would you like to call yourself a thriver? You want to just talk a little bit about yourself, give a little bit of background before we get into drilling you with all these questions that came in through our inbox from our viewers.
Yeah, I want you to give up some of those accolades so they can understand exactly who you are and what you've been through.
Absolutely. Thank you. So I'm Dr. Alexia. I am a triple board certified infectious disease specialist. I am trained and board certified in internal medicine, general pediatrics, and adult infectious diseases. Above and beyond that, I am a mom, a speaker, an author, a coach, and as was said, a breast cancer survivor thriver. And I create healing pathways so that others can experience total health and wellness, mind, body, and spirit.
Wow. So you're just a bad sister, what you just told us. A superhero. Like I love it.
Yes, you are. We got flooded with so many questions. We went through them, Dr. Alexia, and we just picked out a few that we thought, could benefit the entire audience. We actually got another new one in today, and I'm gonna start with that one. It wasn't on the list, but I'm gonna just shoot my shot here. We have someone who's very concerned about those who have pre-existing conditions not able to find health insurance. What do you have any expert insight on that? What should we be telling those people to do when they have pre-existing conditions, whether they're in New York City or wherever they are? What is your advice about that?
So still seek medical attention and don't wait until it's an emergency. Most major healthcare centers, most major medical centers, whether they're university affiliated or not, or whether they're public or state institutions or private institutions, do have some level of discounts for uninsured or underinsured patients. So it still behooves you to literally shoot your shot, just like you said, and call up a doctor's office or call up a health center and see if you can get discounted care. Most institutions do have discount rates for cash paying patients. People have this idea that they have to pay right when they arrive. Oftentimes you just need to give basically what would be the equivalent of a copayment, and you can have structured payments, you can get medication assistance. And it's always better to act before it's an emergency. So if you have underlying conditions, you want to address them before, God forbid, COVID or something else becomes an issue.
Yeah. Thank you so much for that. All right, let's just dive into this coronavirus pandemic, Doc. Where did this thing come from? Where does it come from? Rumors are surfacing that it was created in a lab in China and it has a patent already. Like, what are you saying to some of this stuff that's being talked about? Where did it come from?
So these types of outbreaks or these types of pandemics are not new phenomena, and they precede modern technology, right? This is not the first pandemic the world has experienced, and it won't be the last. So to the people who think that this was cooked up in a lab, bacteria and viruses are way smarter than humans will ever be. And they, by chance, and sometimes they on purpose through various mechanisms that are way more than we can explain in the timing of this interview, they mutate, they morph, they skip species in an effort to survive. The virus just wants to replicate itself, and it needs to hijack our cells in order to do that. So this is not something that was cooked up in a lab. Even if you extend the point to bioterrorism, right? Bioterrorism exists. It is a thing. It is plausible. Mm-hmm. And people think that humans created the bacteria or viruses that can be utilized for bioterrorism. They have not. They've taken naturally existing viruses or naturally existing bacteria and weaponized them. So humans do not create these things. These are present, and just by chance, through mutation and other things that happen on a microscopic level, What happened in this case is we believe that this virus skipped species, that it may have come from a bat. And this is not uncommon. This is not a new phenomenon. We saw this with SARS or avian influenza, and it will continue to happen throughout history.
Wow. And so you mentioned SARS. Do you feel that this is something similar?
Absolutely. So very similar to the SARS virus that we saw in China and in Asia, in terms of the amount of disease that it causes in the lungs, the amount of sickness, and the risk for death. Just the difference is that SARS didn't seem to be so readily transmitted or spread from person to person. That is the huge distinction here, and why we're seeing millions of cases versus, a couple of thousands of cases of SARS, and that was very rapidly contained as opposed to this virus.
Wow, very scary.
Great information.
So, what about so the people that get it, can they get it again? Like, if you're tested positive, you get treated, and you prayerfully you recover, do you have to worry about it again in life, you think?
So, hopefully not, but I can't say no with 100% certainty, because we do know of a small number of confirmed reinfections. So, individuals who were symptomatic, tested, confirmed to have COVID 2019, cleared their infection, meaning their symptoms went away, and they were retested, proven to be negative by the test we used to diagnose an active infection, had a symptom-free period, and then again became symptomatic and retested positive. So this is a very small number of patients. We don't think that the vast majority of people will develop reinfection. But again, viruses have the ability to mutate, and oftentimes there's more than one strain. So are people getting infected with another strain or the same strain? Remains to be determined. But we don't think that on a large scale, reinfection is going to be a major issue. However, this is all brand new, and we are learning every single day. And we're learning from countries that are only weeks and months ahead of us in fighting this pandemic. So we still have a lot to learn and a lot of information to figure out.
Yeah. Now, have you yourself had to treat anyone tested positive for COVID-19? And whether you did or you didn't, what are there's no vaccine, so you get tested positive for it, and then what do you do?
So I absolutely have treated many COVID patients, and it really depends on what your symptoms are. So if and the symptoms vary, right? We know some people will have little to no symptoms. Some people will have very mild symptoms that appear like a upper respiratory tract infection, or what we know as the common cold. And for those people, my literal counseling is, you're going to go home and do all the things your grandmother would tell you to do, right? You're going to hydrate. You're going to, I always tell people, sip hot tea with honey and lemon, not because I think it's going to kill the virus. It's not, but it's soothing, right? It helps soothe the throat. It helps soothe cough. It's a means to hydrate. It's a means to get antioxidants and vitamin C in you, right? So there's a method to our madness when we tell you to go home and do some of these things. And grandma always knew what she was talking about anyway, right?
Right.
If you have a fever, headache, muscle aches, you're going to use Tylenol, and we're favoring Tylenol. And I know we have a question about that coming up, so I won't jump ahead.
No, we can. We can just flow right with it.
We're favoring Tylenol for fever and pain management. Of course, rest, and then also to try to eat, because you need calories and you need energy to maintain your immune system and to fight infection. And you use a lot of calories when you're burning up with fever, or when you're shivering from your fever. So it's important to give your body the energy that it needs to fight, and also to maintain hydration, so drinking plenty of fluids so that you're flushing out the medicines you're taking in, you're perfusing or supplying all of your vital organs, enough blood flow is getting to your brain, to your kidneys, your liver, or pumping through your heart, to maintain the body. So that's on the very mild end of things. In the middle of symptoms would be somebody with moderate illness, might be someone who's coughing a lot, maybe feels a little short of breath, might have a little chest heaviness or pressure with those flu-like symptoms and fevers, but they could communicate their needs. They're not lethargic. They can get up and get themselves something to eat or drink. They're not coughing so much that they can't catch their breath. They're not having such great difficulty breathing that they're lethargic or dazed, or they can't get up and take care of themselves, or they can't speak full sentences or have a conversation. That person is safe at home, but that's somebody who I'm going to check in with by phone, every other day, or have my staff do it. I'm going to tell them that they need to let somebody know what's going on with them, so somebody is checking in and knows to call for help if there's a lack or absence of response. And I'm going to tell them that if your breathing becomes too difficult, because that's the major issue, it's not the fever, it's not that your body aches, it's the breathing. If your breathing becomes too difficult, you can't catch your breath, you can't speak and have a conversation, then it's time to go to the hospital because you need oxygen support. And so on the severe end are the people who we have to direct immediately to the hospital, whether it's from our office or from a phone conversation or a telehealth visit we're having with them. So they can barely complete sentences, they can't speak for themselves, they're very weak, they can't get up and eat or drink, they can't even get out of bed to do something as simple as go to the bathroom or bring food or beverage to their mouth. So those people need to go to the hospital. Things that I'm capturing in the office or somebody might be able to capture at home if they have the appropriate monitoring equipment would be if their oxygen levels are very low, if their heart rate is really high. That tells us that there's a stress and strain on the body and specifically the lungs, which is where the virus primarily attacks before people get into systemic issues. And then it's time to go to the hospital.
Yeah. And then, we're hearing that people that go into the hospital and get on ventilators, 80% are dying. Is any truth to that, or do you have any insight on that?
Yeah, so it's not 80%. I think if 80% of my patients who I made rounds on in the hospital were dying, I don't even think I would be able to function.
Yeah. Okay.
Because for the number of patients that we are taking care of in the hospitals, just the impact of this virus and the death toll is already very devastating. If it was 80% of people dying, it would be futile to even take the time and energy to put people on beds. So people are having prolonged intubations or, needing to be on a vent, needing to have a breathing tube in, needing to be medically sedated for, sometimes 2 weeks or more. But we've seen very awesome and amazing and encouraging outcomes where people are off the vent in 4 days or a week. And so it's a continuum. And it's just like we're seeing in the outpatient where some people have very mild illness and do surprisingly well, and some people are critically ill and will succumb to the infection, but it's not the vast majority of patients.
Good. I'm glad you cleared that up. And you did mention the Tylenol. So, people, there are no Tylenol on the shelves anymore in the stores, but it's plenty of ibuprofen. So what's going on with that?
So the deal with that is there's some concern that ibuprofen and use of certain other drugs may encourage the uptake of the virus. And then other things that we also worry about is the types of organs that are susceptible to injury from this virus, the kidneys being one of them. And ibuprofen is largely cleared from the kidneys. And that's information that we're getting from, again, other countries that are just several weeks or months, a couple of months ahead of us. So I think that the data was out of China initially, and then also some data coming out of Spain and Italy, which is where we're getting a lot of our information from. So the patients who were using ibuprofen and drugs like it, so that class of drugs is called NSAIDs, non-steroidal anti-inflammatory. So it's not just ibuprofen, it's Motrin and Advil and Aleve and all of the other kinds of drugs, generic and brand name like it. It seemed to be that patients had worse outcomes if they were on those drugs prior to their entry into the hospital. So right now we're staying away from it. We actually don't even know if it's factual or hard data. Most things are anecdotal, and we'll look back and then, compile the data once we're out of the woods. But for now, we are staying away from it.
Yeah. This is it's a gift and a curse. I love this show so much, and we've got to get ready to wrap it up. And I've got so many other things to ask and talk about. So what I'm going to do is I'm going to ask 2 more questions from this list, and I'm going to promise our viewers that Dr. Alexia is going to come back on the show in May when we've gone through a few more weeks of this coronavirus pandemic. Dr. Alexia, you see I'm putting you on the spot
Absolutely.
now.
Absolutely.
And we'll grab you for another 15 minutes of time. I promise you all we'll get to the rest of your questions. I'll get to 2 more now.
Well, can I just throw a half a question?
You can throw a
I
half
didn't
of one.
get- I didn't
Okay,
get-
you didn't get any. Go ahead.
So, in all fairness, this is a really quick one. I had a person inbox me and wanted me to ask you, upon the 2 week quarantine, if you were sent home to quarantine, are they retesting the people that's been tested positive after the 2 weeks that they were sent home to quarantine? Are they retesting or not?
Unfortunately, not routinely, and that is because of lack of availability of testing, right? We have to focus at this point on getting the people who are sick diagnosed. And so once you've been diagnosed, they're giving you a 2-week time frame because that is when it is thought that most people will clear the virus and stop spreading it. But I will tell you that there are cases where the viral shedding or spreading can go longer than that, even when people no longer have symptoms. So we still, even if you've gotten infected, were treated, or you recovered all on your own, if your symptoms are gone, I would still encourage you to wear a surgical mask so that you still are preventing the spread or transmission of the virus to other people. Because even though you feel better, you still may pose some risk to people.
Okay.
We are in a situation where, frontline workers have to get back to work. Essential employees who are keeping our cities and counties and states running and functioning have to get back to work. So we do have to be mindful of everyone around us when we do transition back. You cannot assume that just because you feel well that you're not capable of spreading the infection. And so still hand hygiene, not touching your face, and wearing surgical masks would be on order.
Perfect.
Understood.
Okay, I appreciate you so much, Dr. Alexia, and we are going to try really hard to get on your calendar right now for sometime in May on a show, and we will take care of that after this show. And
Absolutely.
and continue this discussion, and we will get to the rest of everyone's questions. So thank you so much for being a part. Once you're in the Spotlight family, you're stuck with us, Dr. Alexia.
I love it. I'm here for it.
Yeah, and thank you again for all of the hard work and perseverance that you're doing. I know it's not easy. I know it can be stressful and the whole nine. So you are in our prayers, and thank you so much because you're so important. Right?
Yes.
Thank you. And yes, please do pray. Like, we have the ability to shift this whole thing with prayer. As much as I'm a scientist, I'm a spiritual being, and I wholeheartedly believe in the power of prayer.
And so, yes, I agree.
And before we sign off, remember, when life gives you lemons, lemonade this shit.
We pay attention.
Love it.
Thanks, Doc.
Thank you, Doc.
Thank you guys.
All right.
Thanks for having me on.
Thanks for being
thank
a part.
you.
Absolutely.
Coming up after this